You mentioned that there's been a spike in cases. They've risen 41%. They rose 41% by 41%. I'm sorry. Early at the beginning of this month. What do you think is causing this spike in cases?
Well, there are some new strains of Omicron, as you may have seen, that have been afflicting people across the nation. Fortunately, what we've seen is that because we have great therapeutics that are out there, because people understand what the mitigations are, they can put on a mask, and when you go into a public place, make sure that you keep yourself safe and other people around you. And also we have one of the best vaccination rates in the Midwest. So that's done a lot to keep people safe. Our hospitalization rate is much lower than it was under the previous strain of Omicron. And I think, again, that has to do with the fact that we widely distributed vaccinations, that we had 7,000 mobile vaccination units. We have the best record in terms of fighting COVID from an equity perspective, making sure that Black and brown people had access to and actually got their therapeutics and vaccinations. So we're doing reasonably well given the spike that you're describing. It also, the surge that's occurring is from a very low point. So when we say 41% increase, it's 41% off of a relatively low point. So just an example, our hospitalizations are down 88% from the peak during January. And so we're at about 12% of where we were back then. And in addition, although we are still seeing the loss of life, those numbers have come way, way down. So again, we don't like to see a spike in cases, but we're managing through.